embryonic hemodynamics. If we look at early gestation, the circulation in the early gestation has got very important things. Once we put on colors, so the first thing which we were discussing yesterday is that we don't have to put the color or power Doppler on uh, regularly. We can use it with intervals so that if there is any unknown hazard, we can avoid that. We discussed that there is no known or documented hazard of color Doppler in a biological life. So in early circulation, once we put on colors or power Doppler, this is the color Doppler and power Doppler here. The things which we have to see in early gestation are the peritorophablastic flow, the flow which is more prominent at a gestational sac, the area having more flow is usually believed to be the area where the center of the placenta will be formed. So it is the intravillous blood flow, this area. Then we have the vessels, the arcuate artery. Then here we can see the radial artery, and the main uterine artery is on this side. The cord here, once we look into the sac, this is the cerebral flow, the umbilical cord, yolk sac is here. We can see the spiral arteries with excessive flow. So here is whole of this is the sac, the inner wall and outer wall. Here again we can see the yolk sac. We have the umbilical cord here, and then is the flow in the cerebrum, which is called the cerebral flow in the head of the embryo. At 5 weeks gestation, embryo and yolk sac not yet visible, just a sac. It is 5 weeks. We usually get yolk sac at embryo at 5 weeks, 4 days onward, or at least at 6 weeks. So once gestational sac is visible and we put the colors, this will be the flow. We can get more flow, but this is the minimum flow which we get. Lacunar formation is there at 10 to 13 days after conception. So when we discuss about the establishment of intravillous circulation, this is very important to know that the lacunar formation will be 10 to the 13th day after conception, very early, filled with blood on day 15. Tertiary villi formation on day 20, and villus capillaries become connected with the embryonic heart tube. This is 5 to 6 weeks again, and you can see the lacunar network here with maternal sinusites, and here is the secondary yolk sac. This is the amniotic cavity, the remnant of the primitive yolk sac. All of this is the gestational sac. The future connecting stalk will be here. So when we put the colors, these are the colors which we will be getting for lacunar space, which are filled with the color flow here. So whole of this is the sac wall, is the cavity. You can see a tiny yolk sac inside, and even at 5 weeks, when the embryo is not properly visible, we can get the flow. So hemodynamics is very important. In intervillous spaces, this is flow, and this slide we just saw.